There is so much being said about the healthcare system and the government's failure to stop the situation escalating to the point it has, and rightly so. And hopefully, the more we highlight the perils of the crisis, we will get adequate facilities from paying attention. To add to the weakened medical sector in the country, like a drought in the pool of healthcare professionals who have left for various reasons, we have to endure critical circumstances after deteriorating stocks of life-saving medicines have led to a delay in life-saving surgeries, making the situation excruciating for some individuals more than others. Imagine not having medicines that will cure a chronic illness you have or not being able to prolong your child's life against a medical condition. Imagine lacking anesthetic drugs in the country and telling mothers to be in charge of their birthing plan because cesarean operations are no longer an option to them. Imagine being waitlisted for crucial surgery, again, because there are no specialists in the country or the required medicinal drugs are currently available. What about the situation we only need to imagine has turned into reality today? So many people across the country are suffering, and there is nothing much anyone else can do to relieve them from their pain than look to the government to take accountability and fix the cracks in the system to prevent further loss and pain. But of course, that would be seem more like a pipe dream than getting an abundance of crucial medicines to save all those afflicted. Meanwhile, officials are busy pointing fingers at each other while the situation worsens. And because the idea of effectively managing the health crisis is to withhold information, they're taking action to prohibit those with the real picture from presenting it as it is to the general public. Why? It isn't rocket science to conclude that the only reason something official as a circular would be sent to healthcare workers demanding they abide by it is perhaps because they want to ensure that whatever is in public interest should be kept from the public for the very same reason. Meanwhile, these challenging times also mean that already existing healthcare disparities are exacerbated and those already facing discrimination are plunged deeper into the crisis. Notably, transgender people are discriminated for their sexual orientation and gender identity and are often dealt with the worst end of the stick, meaning health inequities are further widened. These individuals are left feeling even more helpless given the inflated price structure for medicines and the drug shortage in the country. Transgender individuals, for instance, who, as it is, are discriminated when they seek healthcare services due to social stigma, are facing an essentially tough time because the specialized services they require are only provided by a limited number of professionals, out of which have left the country. If not that problem, the necessary medicines they need are unavailable, too expensive, or these individuals have to travel long distances to get access to these niche services which are unevenly spread across the island. As a result, a disruption in the supply of medicines to these individuals could cause various symptoms resulting from the hindrance in continuity of hormone therapy and also induce a fear in transgender individuals pertaining to the reversal of certain physical changes crucial to their transition that would otherwise progress smoothly through gender affirming healthcare. This distress and feeling of neglect and isolation naturally will impact their mental health negatively, resulting in increased levels of anxiety, depression, and other mood disorders. To manage these emotions, mental health support, another service that is prevalent in some parts of the country, needs to be improved island-wide with more professionals specializing in the care of transgender individuals is vital in order to capacitate them to cope with the aforementioned challenges they do in this time. Moreover, we need to strengthen educational awareness programs from grassroots, starting from school education to do away with discrimination that contribute to these individuals being apprehensive to even seek medical assistance in some instances. Additionally, gender affirming healthcare services should be made more accessible to all, with for more professionals specializing in these services, as we are to be able to provide better healthcare for everyone.